let's tackle what you should eat if you have diabetes or fatty liver or gout. Really, we should just throw in what to eat if you want to avoid those things as well, because all of them are correlated and all of them have a similar diet. Now, diet is something that is stereotypically difficult, right? There are so many different things out there. There's so many fad diets out there. There's so many traditional diets out there that don't take out quite as much as a lot of the fad diets, but are effective. There are things that take out a little bit, but are still effective. There are just all sorts of ways that we can go. There's all sorts of conflicting information. So if this is something that you've been confused upon, this is the place to be. I'm Dr. Jeff Cumro. I'm a developmental function neurologist, and really what we focus on in my clinic is balance, physical, mental, emotional balance. And when we can get you there, that's really where health lies. To get anything done in life, we have to get out of balance. It doesn't matter if we're talking about, taking an action or starting a business or starting a family. We have to get out of balance in those ways. The ability to return to balance, though, is really where health lies. Now, I'm going to start out the whole video here with a story. And as we go through, we're going to talk more and more about this story. So it's important to have the background information because there are a lot of people out there that are really struggling with what they should eat. They're really struggling with some of these diseases coming their direction. And it's confusing, right? It causes a lot of problems. So I had a patient come in recently, and this patient was struggling with weight gain. They were struggling with a lot of fatigue. They had some muscle and joint pains. They weren't sleeping as well as they should. They went to the medical doctor, and medical doctor did some different lab work. They did a CMP, CBC, they did thyroid tests, and everything came back clear. So first thing we do is anytime they've recently had anytime that they've recently had lab work, we request that lab work and get an idea of what we're looking at, because it's hard to answer questions without some of that stuff. Having the lab work done regularly is an important thing. We should have it at least every 6 months. I get mine done every 3 months because it gives us a pretty good indicator of where we're at. So on this lab work, we're looking at it. Everything was within the lab normals. So lab averages, I don't like because they really don't give us a great representation of where things are. That's another thing for another video. But ultimately, what we look at in lab averages are 96% of the population falls right here, 2% high and 2% low are considered abnormal. That's when we flag a finding. So my problem with all of this, are 96% of the population healthy? I don't think there's anybody out there that's going to say that 96% of the American population is healthy. So why would we consider 96% of that population to be within the normal range? Doesn't make sense, right? At one point that did make a little bit more sense, but as we've gotten more and more unhealthy, it doesn't really make a whole lot of sense anymore. So what we're going to look at in my office is more optimal ranges. And when we looked at it in this way, their liver enzymes were a little elevated. So we started them out on a diet. So before we got any information, we're like, okay, we want you to start this diet right here. This is what we want you to aim for, and then we'll get some other lab tests. The lab tests that I wanted to get a reading on their insulin. I wanted to get a reading on their uric acid to go along with things. And the diet that I started them with is pretty much straightforward. It's pretty simple. Meats, especially lean meats and seafood. The seafood is going to be very, very important in multiple ways. It's going to give you those omega-3 fatty acids that are going to be healthy for, the brain and the heart and all these other areas. The omega-3s are also going to help with skin. They're going to help with eyes. They're going to help with a lot of different systems throughout the body, but they're also going to help you have that good, healthy fat that drives the membranes of the cells to produce things the way that they should. Obviously, that becomes a problem in diabetics or people with gout or different issues like that, where the cell membrane gets a little bit thrown off, the hormonal systems get thrown off, and that causes some big problems. So the omega-3 fatty acids are very, very good. If you don't do seafood, getting the lean cuts of meat, good choice. Obviously, as much grass-fed as you can get, pasture-raised, pasture-finished, things like that, cage-free chickens, whatnot. When we're looking at vegetables, eat as many vegetables as you want. Organic are obviously better than non-organic, but eat vegetables, and you can have as many of those as you want. When we're looking at fruits, what we do in these populations, fruits are something that a lot of people like, right? So if you tell them they can have as many fruits and vegetables as they like, they go in, they pound a ton of fruits, they don't eat too many vegetables. Now, is this a problem in and of itself? I mean, you're still getting the fiber and the vitamins and minerals and different things like that. Where fruit becomes a problem is especially in those high glycemic fruits, when you're having melons and you're having bananas and you're having grapes and you're having all these that really drive your blood sugar up. If you eat a bunch of those in one sitting, what's the difference between eating that and a bunch of sugar? There's not really much, right? So we really want to minimize those fruits. We want to keep them more low glycemic, the berries and things like that. If you need help figuring that out, just Google low glycemic vegetable or low glycemic fruits versus high glycemic fruits, and that will give you a little bit better idea on that. Biggest thing on this, minimize sugar. And not all sugars are made even. They're not equal. So fruit sugar is going to be better for you than, say, table sugar. Table sugar is going to be better for you than corn sugar. Corn sugar is going to be along the lines of some of these artificial sweeteners that we're finding are carcinogenic and different things like that. So really, when we stick to fruit sugar, that's going to be the best thing. If you can take all other sugar out, that'd be even better. But really minimizing the corn sugar and the sugar that you drink. And why is this important? When you have corn sugar, your body reacts in a little different way. Your gut can handle X amount of corn sugar, and it can't handle a whole lot. It's not something that you have a difficulty reaching. So once you reach that threshold in the gut, your gut fenestrations start to open up, and that corn gets into the liver. In the liver, you start adding fat to the liver. This is where fatty liver disease and some of these liver enzymes start to go up. After that, it dumps into the bloodstream. You start seeing your pancreas dump in a bunch of stuff. So your pancreas gets inflamed. Your blood vessels start to get inflamed. Your brain starts to get inflamed. The gut and brain barriers open up, ends up having an impact on your immune system. So it really goes throughout the whole body. The kidneys get thrown off. Everything in the body gets thrown off once you have a bunch of sugar in your system. So regulating blood sugar is really what this diet is all about. It doesn't matter if, like I said, if we're talking about diabetes, if we're talking about liver disease, if we're talking about gout, all of it's the same stuff. It's all the same thing. That blood sugar is driving up, it's inflaming different parts of the body, and really what we're naming that based off is the part of the body that's getting inflamed, right? The fatty liver disease, you're getting it in your liver. Used to be, called cirrhosis. Now they changed the non-alcoholic fatty liver disease because people were mistaking cirrhosis for just alcoholics. It doesn't happen that way. You can have it from eating a bunch of corn, getting that blood sugar out of control. The gout is just in the joints mainly. So it depends on which area, but these are all very similar issues. They're all linked together. Very, very important to remember. So that is the big thing. Now, we talked about drinks as well. There are a lot of people that are like, I'll just drink a shake. And they have a shake for a meal. And shakes are okay, but you have to be very careful on what type of shake you're getting. Drinking soda, drinking sugary lattes or different coffee drinks like that. Drinking sweetened tea, drinking shakes that have a bunch of sugar. All of those things have a ton of sugar, and the problem with drinking your sugar is when you drink your sugar, it's already partially broken down. So it gets into your system even faster. It overwhelms that system even more, and your blood sugar jumps even more. This is why avoiding the sugary drinks is so, so important. Staying hydrated with water is going to be your best bet. I know a lot of people don't like water as well, but you know what? Some things in life we just have to go with it, and water is one of those things. So absolutely, if you can avoid the sugar drinks, do that. It's going to make a huge difference, especially those people who are drinking 4 or 5 sodas a day or have a bunch of Gatorade or Powerade or different things like that. It really jumps that blood sugar up. So if we can eliminate that, they see a pretty quick change. So going back to this person, what did we see? So we ordered insulin level and we ordered their uric acid level. Came back, their insulin level was 19. We'd like to have it under 9. Once it's over 9, you start seeing a ton of insulin being pumped in. Now, what is weird about this? When we looked at their CMP, their blood sugar was normal, right? But when we look at their insulin is through the roof. What does that mean? It means they're using a ton of insulin to keep their blood sugar normal. So right now their blood sugar is normal, but they have to use a ton of insulin to do it. What this is going to lead to sooner or later is that you've lost the sensitivity to this insulin, and you're going to lose that sensitivity to the blood sugar. That blood sugar is going to start to creep up, and that's where you're going to get a diabetes diagnosis. Uric acid is also a good indicator on some of this. As you start to break down some of that corn and different things like that, you start to produce more uric acid. As you start to produce more uric acid, it starts to build up in joints and things like that, and that's where you can get a gout diagnosis. Now, on uric acid, if you're under 7, they don't give you a gout diagnosis. So if you're at 6, they don't give you a gout diagnosis. But if you're at 6, your uric acid is too high. So again, this gives us a pretty good idea of what's going on in the system. So this person, didn't have any outward signs on the CMP, the CBC, or thyroid. When we looked a little deeper, we found why those liver enzymes were a little high. We found that they're working way too hard to keep those normal values over here. So if you are struggling with something like this, there probably is an answer. If you're going to your doctor and you're not finding the answer, there probably is an answer in some way, shape, or form. You are feeling what you're feeling, and we just have to look for the right things. But if you are struggling, if you know you're at risk for diabetes, for gout, for fatty liver disease, if you know you have those things, or you have pre-diabetes or different things, start making these changes in your diet now, because they are going to make a massive difference in your health. What did this person see? Within a few weeks, they were feeling significantly better. The muscle and joint pain had gone away. They were sleeping better. They had better energy regulation. Now, some of those values were still high. We tested them a couple months after that. Those values were still high, but they were coming down significantly. So we were making progress in this. And that's the big thing that we have to evaluate. We don't have to do this all at one time. We have to make progress throughout. That's what should be evaluated. So I love you guys. I appreciate you. If you are wanting more information on how health comes in to balance, how balance is important for all aspects of health, go to my website, drjeffreycumro.com, and go to /checklist. And what you're going to find there is it's going to be like a cognitive assessment form. It's going to give you an idea of your ability to return to health. It's a free form, not going to spam you, not going to do anything like that. It's a free form just so you can figure out where your health is at, where you're struggling at, and what we can do to get you back to where you need to be. Love you, appreciate you, and I will see you on the next video.